Welcome to the Health Reporting and Solutions Journalism webinar. As we're waiting for a few more people to filter in, you can feel free to use the chat to let us know your name and where you're watching from today. And we will get started in just a minute or two here. The past couple years, health and access to health have been at the top of everyone's minds. And the COVID-19 pandemic has also laid bare a lot of disparities and unequal access within the health system. So today we have brought a number of wonderful panelists together to talk about their experience in health reporting and also how to cover these solutions to these very big problems that health systems are facing all across the globe. So without further ado, I will pass it off to Andrea and she will get us started.
Thank you, Kimberly. Hi, everyone. As Kimberly mentioned, my name is Andrea Wu, and I'm pleased to be your moderator for today's event. If you have questions at any time, please do enter them into the chat box that you see, and we will do our best to get to them closer to the end of the hour. I'd like to acknowledge that I'm speaking from the unceded and traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations, and I'm grateful to live and work on these lands. Just as a brief introduction, I'm a staff reporter at the Globe and Mail, where my work focuses largely on health, including the COVID-19 pandemic, the toxic drug crisis, mental health, and the impacts of climate change. We have three incredible panelists today. They are Odette Uager, who is an Indigenous freelance journalist living and working on the Klahoose, Samalco, and Tla'amin territories. Some of her recent work has been published in the Resolve, Watershed Sentinel, La Converse, and Indigen News. Next, we have Moira Wyton, who is a Vancouver-based journalist covering health for the Tyee, a nonprofit independent online magazine. Her reporting focuses on the COVID-19 pandemic, the toxic drug crisis, and mental health care in British Columbia. And last but not least, we have Huynh, who is editor-in-chief of The Local, an online magazine covering urban health and social issues in Toronto. Welcome to our panelists. I'd like to begin by asking each of you your thoughts on the current state of health reporting today and what impact you feel that the pandemic and the last couple of years and everything that came with it had on health reporting. Ty, can we start with you?
Yeah, I think I can start by saying, to build on what was mentioned earlier, I think the health issues, I think the pandemic has shown is pretty much linked to a whole bunch of other structural issues in society that crisscross race, class, and a variety of other factors that we traditionally call the social determinants of health. I think prior to the pandemic, these things have been known to have great effects on the health of populations, but these things actually happen at a glacial pace. These things don't happen overnight. You experience them through your lifetime. The pandemic had really accelerated that. We saw, neighborhoods that were, heavily populated by, essential workers getting huge rates of infection. We saw how vaccine distribution didn't really go to the right places. The places that really needed the vaccines ended up being the places that were the last to get them. And so the pandemic really showed, I think, at almost like a fast forward, if there's a fast forward button on, the health effects of these social and structural issues, the pandemic really made that happen.
Moira, would you like to go next?
Yeah, I really agree with Ty. And as someone who started her role as a health reporter, like literally 2 weeks before lockdowns began in Canada, I feel like I just got a crash course. And so I don't know health reporting really outside of the pandemic environment, but it's been really wonderful to see. I mean, obviously before the pandemic, the Tyee investing in advocating for that kind of position. And I think other papers and outlets have really done the same in the pandemic, and it's made it really wonderful just to have you, Andrea, being the dedicated Globe health journalist and one of them, and just this renewed focus on the health beat and how vast and broad it is. And also starting this reporting, as we're all trying to figure out like epidemiology and stuff, I feel like there's been a really great sense of like collaboration and teamwork, because almost every journalist has become a health journalist or in some way has had to become that. And so I hope that kind of more awareness of how health and the social determinants of health are so interconnected will remain, like even as the pandemic changes and our understanding of it improves, that we'll kind of sustain that dedication to health journalism in newsrooms.
I just noticed that there are some people in the comments saying that audio was briefly not working, but it seems to be all good now. If there was anything in particular that you missed, like any person, any piece of it that you want repeated, let us know, or you can catch it in the replay on YouTube afterwards, which Kimberly just shared the link to. Odette, how do you feel that the pandemic impacted health reporting?
Well, I'd like to take on to Moira and Ty's comments very similarly to Moira. I started as a health reporter for Indigenews just a couple months after the start of the pandemic. So I don't know what that role would have been like pre-pandemic. And on a personal level, it was a lot about navigating community connection amid travel bans and closed gates. But, in the big picture, broadening that scope, I think that it really did underscore that and the need for a really foundational understanding of an Indigenous lens with health and wellness, just extending that conversation about the social determinants of health. I found myself quoting First Nations Health Authority here in BC, almost every pitch, describing how health and wellness, it's not just the nation's wellness, it needs to be the community, which means family relationships, and which also means relationships to land. And so that brings in language, culture, many levels of things. And so I found that having to be sort of that voice and advocate for stories that were not single thread stories was really important, and I think successful, finding different ways into those stories. And I think that, I think people started to look at things, hopefully, with those lenses in mind, that you can't focus on this single problem and leave it there. The solution, if the problem isn't single thread, then the solution probably isn't either.
I thought it was really interesting how Odette and Ty, you both mentioned how it sort of sped up the impacts of the social determinants of health, like what we are all very familiar with. You immediately began to see within a couple of weeks, and how vast the disparities were between different neighborhoods and different groups. Odette, you had mentioned when elders started dying in Alert Bay, and like how you had to bring light to that, and it was very, when we're going through COVID and there's a lot of top-down information that you're reporting there was, bottom up from the ground, from talking to people. Could you tell us a little bit about how that came to be?
I think that conversation continued. I had a really supportive team, and in our, I guess it would be called a newsroom in other outlets, but for our team meetings, it was a lot about which narratives we're going to amplify and which threads. And that set our funding model through LJI, Local Journalism Initiative, and just maybe a more standard way of looking at health reporting would be like, what are the cases? How many are there? What protocols are in place? And we could write that same story for every single community in our beat. And I thought this was a more interesting approach, would be to ask communities what stories they wanted to share. And for a lot of nations, with their ceremonies and with their traditions, they might not speak about that person for at least a year. So that doesn't mean a reporter can just jump in there and how does this feel? How does this feel when your language keepers are passing away right before your eyes? So it took a really a lot of deep breaths and a lot of waiting for communities to be ready to speak about these things. And I think that's always the best way, like with responsibility and respect being really, first and foremost in our approaches. I think that sometimes that meant we didn't have the fastest story about a rate or an outbreak, but it meant that we had the broader context, or a more personal share if we waited until we were invited into a story in a better way.
Thank you for that. A lot of reporting, for obvious reasons, focuses on problems, highlighting failures in policy or institutions or government, for example. How do you go about also showing solutions? Ty?
Yeah, it's hard, right? Like, I think oftentimes the critical stories are the ones that get page views and, get a lot of attention. And so the positive stories, the solution stories, maybe don't do quite as well in today's kind of, media atmosphere. But I think as a publication with our mission, which is to tell stories, hopefully that will make a positive impact in various communities in Toronto, we felt it was important to also do solutions journalism. And we got our whole team trained on solutions journalism through JHR, and that was great. And wanted to make sure that we put out our content on an issue by issue basis, so that there's always a mix of, yes, those critical stories, but also are there interesting solutions that people are working on that are helpful to the community that others, by learning about it, could actually replicate, right? And that's how maybe you address some of the issues, the equity issues. In one community, for example, I mean, we did this a lot during the pandemic, during the vaccine rollout. We had, for example, a neighborhood called Thorncliffe Park in Toronto that was really falling behind on the vaccination efforts. And, it's a population that's largely made up of people of the Islamic faith, and a lot of the vaccine clinics just weren't accessible to them during kind of daytime hours. And so some of the locals started, with volunteers, organize a vaccine clinic that was open at night. So after, the iftar, after they've had their meals during Ramadan, they would all go out as families to get vaccinated. So these were like really interesting local solutions that we wrote entire stories around. And I think with the hopes that others would find it useful, and other vaccine clinics to try to replicate that.
Moira?
Yeah, I think similarly to what Ty said, like the pandemic really exposed, I think, like how a lot of things that we take for granted or we see as like results of individual behavior on health are actually like, policy choices and like manufactured by like decisions and how our money is spent. And so I almost think that like made it more like it made the news more like fruitful for solutions journalism, because you had this like new consciousness in readers and in journalists and newsrooms that solutions are possible, because we're like, our decisions are creating these problems. They're not like necessarily naturally occurring problems. Like we have this dual agency as well. And I think about like covering the toxic drug crisis, which Andrea, in depth as well in BC. There's almost this like naturalization that people think it's just like the way it is. And I think the pandemic, with how much government moved to like help people stay home and get vaccinated and all these things, we see that there are actions we can take to like get people healthcare that they need and get people like the supports and the like resources that they need to stay well. That the drug supply doesn't necessarily have to be only unregulated and illicit. And so I think about a story that I covered recently about a doctor who's now prescribing fentanyl at like a market price to essentially have people, like she said, break up with their drug dealer. And I just think about like those really innovative solutions and how they help readers really think about their own agency and like what is possible. Because if you don't see that it's possible to change things, it's very easy to, I think, just get caught up in the doom and gloom. And as a journalist, I totally feel that. I think for my own mental health, I'm really trying to be deliberate about seeking out solution stories.
Odette, how do you go about also showing solutions?
Yeah, I think this is an interesting question for especially my work at Indigenews with the health reporting role. We spent a really big amount of our time in our weekly meetings trying to talk about which narratives we would center, which stories we should be writing, the need to uplift. And definitely we heard that feedback from our readers when we asked. There's a lot of wishes for good news stories. They already knew the hard stories. That's their lived reality. So they wanted to hear, who was winning the awards and who was bringing this interesting initiative to their community. And for me, just speaking for me personally, there was always a really fine balance between definitely wanting to uplift those initiatives, maybe attracting attention, which might even help them, advance their project, but also wanting to honor the lived realities and the really hard work that's going into addressing and living through some of those many ways that people are living in through ongoing traumas, from colonial systems. And I could divert that. So I'll resist the temptation for that hour-long conversation. But I really thought that I wanted my work to be always a way to find a way to write those stories. If writing flat out about opioid crisis and different resources that were in the communities I was working with, maybe that was, too dark, or it wasn't the thing at that time to write about. I was like, okay, well, let's think here. How about if I interview the great work of an independent filmmaker who's documenting her community's compassionate approach to harm reduction. And so therefore it's a good news story, but it also digs into those layers and presents solutions in a creative way, in an interesting way. And I think that it's also a way to not just to sneak my pitch in, but it's also a way to expand readers' comfort levels. There's hard news. My sibling is already going through this in a really personal way with addictions issues. What happened? What have you? Maybe they just don't want to read more about that on a page, but entering it from a different approach, and expanding the story and adding some other levels, it is inspiring. It can bring hope, and it definitely amplifies the solutions that are being presented.
I really appreciate that, because especially when you're reporting on something like the overdose crisis, the toxic drug crisis, it's really hard to have any sort of good news out of that. But I think that's a really brilliant approach to highlight the really good and positive work of a local who is doing something to affect change in something terrible. So it sort of feeds into this next question, which is, how can highlighting possible solutions to problems in healthcare help build a more equitable system for all? Ty?
Yeah, I think it's, yeah, I think we try to, my interest is also data journalism, how we can use data to really be a bit more objective in terms of what we're saying about what works or not. And for things that do work, hopefully they do spread. One of the things that we did during the vaccine rollout last April was, you probably all remember, especially in Toronto, there was these massive lineups, right, with vaccine clinics, these pop-up clinics that were snaking around the blocks, et cetera. And I was curious about that because the media was all over that. It was a critical story, right? But when you dive into it, which we did, it turns out these clinics were, the pop-up clinics that were set up in the parks in the back of a apartment building were actually way more effective than the mass immunization clinics set up by the city. And that helped counter this narrative that these, let me just show you, if I can share a screen here. So this is the story that we did. we ended up with a very, my editor, Nick Kimbaum, decided to reshape it, and the lead ended up being something that's critical. But then we get into, initially I wanted this to be a solution story first and foremost, but we ended up doing that at the second half of this. But you can see here, this is the data that we have here, which shows that these are the clinics down here, the MICs, the mass immunization clinics that were appointment only, and what they're administering on a daily basis compared to these tents, these pop-ups that were set up in the park, which were blowing them out of the water in terms of how many vaccines they were able to administer. And yet the mainstream media, the way it was covered, it made it seem like these pop-up clinics were doing a very bad job because the line were so long, when in fact, these clinics actually were having huge volume, but they're also located in the apartment buildings and in the neighborhoods that were marginalized and disadvantaged, full of people who can't speak English, who are not digital savvy to go and book the appointment at one of the city's run clinics. And so we felt it was important to tell this story because these pop-up clinics were doing amazing work, and yet they were completely being presented in a negative light. And I think this story had an effect in the city in terms of encouraging more of these pop-ups. And these pop-ups were run by very smart people that knew the science of how to manage queues, et cetera, to get the most out of them. And a lot of that wasn't talked about at all. So for us, it was really important. And it was part of the equity kind of perspective to say that, yeah, these things might look like that, at the surface, but they're actually a very equitable approach to rolling out the vaccines, and they're actually doing a very good job.
And Moira, what do you think about how highlighting solutions can help improve our healthcare system? You are on mute.
Thanks. 2.5 years in, here I am again. I think I got ahead of myself a little bit in my last answer, but I think reporting on solutions is like a really important way of helping readers and journalists and policymakers like imagine otherwise, to borrow a term from one of my profs at UBC, and just like think about what is possible in like ways that we maybe haven't had to think about yet, or I really interrogate those problems that we think of as natural and just the way things are versus creations of our own governments and public. So I'm thinking of specifically of a story I wrote about the government safe supply numbers in BC. So basically, safe supply is a harm reduction intervention that aims to provide like untainted, regulated versions of street drugs to people who use, so that they don't have to access the illicit supply and all the harms and unpredictability that comes with it. And BC has said, we're doing like, they said that I think in February, like 12,000 people have like accessed this. And then when I, dug a little bit more into it and talked to some people, it was actually, they were counting a pharmaceutical program that's not really what drug users and activists and experts say is like needed for safe supply. And so even though that was kind of more like a critical coverage of the solution, I think it helps people, understand what is being done within the context of what could be done. And I, obviously every story you write, you hope it will change everything. It won't, but I do hope that like even just by speaking to people and helping them feel like heard and validated and platformed as they're going, doing this really hard work, and living these really like difficult lives by circumstances that are imposed on them. Like I hope that that can be like healing and empowering and validating for them. I don't believe that a problem has to go away in order for like a story to have been worthwhile. And that's, I think, as journalists too, like the moral injury component of it can be really tough when it seems like nothing changes or things get worse and worse. Like, Andrea and I exchange texts on big report days, and it's always like really tough, but there's something to be said for kind of releasing yourself of the like, I have to fix this through my story, and finding other ways to affect change and hopefully make a positive difference.
Odette, did you want to add to that, about how solutions-based journalism can help make things a little bit more equitable?
Yeah, well, very similar to Moira's thoughts. Excuse me. I think there's something really beautiful about interviewing someone who's doing the hard work and who's had to persevere, faced obstacles. My story for Indigenous about island health and backlash after the In Plain Sight report, and giving some of the background on things that were happening within those departments of cultural safety. I think that just having those voices on record was really important, and at the same time honoring and thanking those who took risks and who were dealt consequences for using their voice in their workplaces. And so there's the hope that public attention can impact systems. I think I shared a link with knowing your rights in Canadian hospitals, and that one it's actually interesting. It just floated up again in Twitter, sort of circling around again, but that was a while ago now. It was in November 2020, and Native Women's Association of Canada created a toolkit, Knowing Your Rights, and it was, hoping to combat this forced sterilization of Indigenous women and in our healthcare system today. And it was hard to hear some of those stories. What was harder was connecting with friends, even just casually, and colleagues. Oh yeah, let me share this story with you. And we all had a story. And I think that if that can create awareness, sharing a specific resource to people who need it and can use it and share it further, I think that was really important. But also just normalizing some of these conversations. Some women weren't really aware of what had happened to them until they heard someone else sharing a story. I had more than one person reach out to me after the fact, after they read the story, and share their stories. I'll share a snippet of a personal story of my own, which I feel, rather than sharing other people's personal life stories. My third child, I was a really difficult birth, rushed to the emergency room after he was born, and I was losing, over 3 liters of blood. And I was on a gurney, and a lovely nurse, lovely doctor came up to me and said, "Odette, are you done having babies?" I just sort of vaguely smile. I was pretty tuned out, just about to go in for a procedure and to see what was going on. And she was saying, "Because we're already in there, we're already going in." And then I thought, I was so tuned out, I couldn't process enough to say yes or no. But that was her asking me for consent for a tubal ligation. And so, if I had have been just a little less, I might have sort of said, "Yeah, I think I'm done having babies." And would that have counted as consent? The odds are, when you look at the story and you look at the stats and you look at, there's no consistent methodology in place for obtaining consult in Canadian hospitals today. And so I think that having these toolkits and having these resources are absolutely essential. And Indigenous women don't trust these systems, don't trust authorities necessarily to report things after. So we do know that the number of women impacted is much higher than the 100 women who joined that lawsuit. And so I think that, there's a lot of beauty. I started off talking about the beauty of amplifying these voices, but at the same time, there's a really grave responsibility here to communicate what needs to be communicated. And, always with that hope that things can improve.
How did you realize that was an official request for consent and not just, some nurse making small talk?
I think it was just in hindsight, hearing the stories of how other women had gone in and come out sterilized, and it was through very similar.
Jeez. Wow. We have one question queued up that we are going to get to very soon, but I just wanted to remind people watching to enter any questions or comments you have. We're going to turn to those very soon. Our panelists have started talking and sharing about a few of their stories. I was hoping we could go into that a little bit more, with each person sharing another example of a story or two, and just talking a little bit about how you incorporated solutions into them. Who would like to start off on that one? Moira?
Don't mind me trying to find the email of all the stories I sent. Yeah. Oh, here we go. Okay. So I think maybe I got the vibe wrong because I reported on like a lot of more like critical solutions journalism, which maybe is still part of solutions journalism. But recently, BC submitted and was approved to decriminalize personal possession of small amounts of some illicit substances. And that proposal has been in the works for like, I think just under a year now. And Vancouver has been pursuing the same thing. And essentially you need, both these jurisdictions need federal approval because it's a provision under the Controlled Drugs and Substances Act that allows a minister to make this kind of exemption. And so the idea is that decriminalizing small amounts will reduce the harms of criminalization, the stigma around substance use, and hopefully encourage more people to utilize services and harm reduction and treatment and recovery should they wish. And so Andrea I feel bad, I just keep, Andrea and I report on so many of the same things. I love learning from her, but we were covering this. And when they announced it, the threshold for possession was much lower than had been recommended by the province and by Vancouver, and also which was already much lower than drug users and experts had said would be effective, considering that a lot of people buy multiple hits in like one go, or they have mobility issues, or all these many reasons that people would carry a bit more like drugs on them so that they don't have to, engage with the illicit supply like multiple times a day or for a few days. And so I think it was tough because when I wrote this story, I like wrote about the plan and what the government was saying, and then I wrote about what others were saying where it fell short. And I got so many comments on the Tyee being like, can't you ever like report on like the good news? Like, can't you just like appreciate that this is like a good step? And, I did, and I quoted people saying to that effect in the story, but I totally empathized with the readers who are probably like, oh, this Moira always has something bad to say about whatever's going on. But, I think obviously I have very supportive editors and it wasn't like a harassment issue, but it did make me think like, who is asking for like the good news? And like, whose job is it to say that this is good news? And who do I listen to when I am trying to figure out if this is good news? And I think it comes down to the fact that no one is more affected by the toxic drug supply and the crisis than people who use drugs for whatever reason and in whatever amount and frequency. And they're the people that I'm going to listen to when they tell me like what they need or what would help them feel safer or, access what they want and live a better, have a better quality of life, no matter their decision to use drugs or not. And so when that kind of happened, I realized that, it's reporting on solutions journalism is so important to be critical and to, be rigorous when things are working, but also to really like make sure that you're not just listening to experts, to like academics and government saying like, this is a huge step forward, because it very well is. Like, it's a big deal that BC is decriminalizing personal amounts of drugs. Like, it's the second jurisdiction to do it in North America. But I just think like it would be a disservice to the people that this is supposed to help and benefit, to not ensure that like their thoughts and their needs are central in the story. Because I guess I always want to err on the side of a more balanced, like rigorous piece, rather than just giving in to the like desire to report something as good news and kind of be like, great, like we've done something and this is going to improve. Because I think that also is a disservice to our understanding of the crisis. And then, you know, in 2 years, if deaths continue to rise as they have been, well, they've plateaued, but if they remain high, I worry that then people will be like, well, we decriminalized drugs and that didn't work, so we should just go back to like how it is, when really you need a more fulsome understanding of what's needed and the limitations of any solution that's introduced.
Odette, did you want to give an example of a story that you did that incorporated solutions journalism?
Okay, well, I think that one, knowing your rights in Canadian hospitals, by virtue of discussing it and presenting a resource to be used, that's one. One story that was one of my favorites was Army of Kwakwayakwa doulas bringing birth back home. That could have, and it could have been a much different story too, when I started pulling the numbers and how difficult it was to have births in those North Island communities. That's North Vancouver Island. You know, it's about 4 or 5 hour drive to the nearest big center, and all kinds of resources being put into Camel River District Hospital to improve that as a hub. You know, I did do stories on all those smaller bits, but this one was the one that really focused on, you know, building capacity in the community. And, you know, a really large number of people stepped up. I want to learn that skill. I want to be part of that solution. We can do this in our community. And, you know, it was really moving in different ways. And it was also one of those moments where, you know, focusing on the solution instead of critiquing the policy or the, you know, the previous decades of poor decisions that had led to this situation. By focusing on the solution, to me, again, it sort of tapped into that notion of story has agency and story has its own energy, you know. And my favorite moment in that story is when one of these doulas, you know, by the second interview with her, she said, and you know, my family just let me know my grandmother was one of the biggest midwives in this area, and it had just been a lost piece of information. And you know, because of the impacts of residential school, things were not, you know, the threads were cut for many of us. You know, our mothers were detached from what their grandmothers had known. And so there's always that cycle of reclamation. But it was just such a beautiful thing. She had found her calling and her path, and then found out this was something that, you know, had there not been the systemic and oppressive policies in place to try to sever that type of traditional knowledge moving forward, she would have been handed that by her grandparents. And she found another way. There's this other resource that's training women to be able to do this for themselves and their babies by having access to trained doulas in their communities. So to me, that was really beautiful and solutions-based, and also, you know, just entering it with the solutions lens invited that story to happen, that conversation, that interview to go in that direction. And I wouldn't have heard that otherwise. And so I thought that that's something interesting about that approach also. And I think overall that, you know, another story, I didn't share the link, but it was writing again for Indigenous News, was writing about a Cuts Common. It's a treatment center just outside of Port Alberni. And it was a story mostly about environmental racism, but it was a health story in that it was impacting a treatment center that has it's unique in the country, that it has a holistic approach. For instance, if a parent needs to go to a treatment center, they can bring their whole family, and there's school right built in. And so their children can still continue with their studies and also access supports, because they've also been impacted and they also have triggers that need to be resolved. And their partner, who's, you know, been by their side through their struggle with addictions, is now by their side through their struggle through treatment. And so it's a beautiful treatment center and powerful people like Lisa Robinson at the helm there. And at the same time, really embedded in the struggle of what was happening, environmental impacts happening with a project that was threatening that atmosphere of the country treatment center on a peaceful, quiet country road. And so we dug into that. And by focusing on the solutions, I like to hope that the story helped draw attention with their parliamentary petition that was going on right around the same time. And they did win that battle. And so their treatment center was able to continue without that hindrance. And so, and again, if I had have approached it differently, I don't think that, whatever impact that story may have had in awareness building, I don't think that would have happened in the same way.
Thank you for that. Ty, did you have another example that you wanted to throw out there?
Yeah, the other example, it's in the link in the chat box. It's called Inside the Push to Bring Vaccines to the Schools That Need Them the Most. It was a story I did back in November of 2021. And it was really our attempt. I mean, the city actually had learned a lot about the vaccine rollout. At the beginning of the vaccine rollout, about 10 months prior, it was like, we're going to set up these clinics and you book, and if you can't come, that's your problem, right? Like, and it created this mad Hunger Games kind of atmosphere where everybody's trying to, like whoever, like survival of the fittest. But the city had learned a lot from it in the 10 months since, and it realized that the way to do this equitably is to actually bring vaccines to communities, to people. And when November rolled around and the federal government was about to approve the pediatric vaccine, we were interested in, well, what are these communities doing? What is the city doing in terms of the solutions around vaccine equity that we saw 10 months ago that's now being rectified? So I shadow a bunch of vaccine organizers on a PA day in November, actually on the same day that the Health Canada approved the vaccine. And they were going into these schools that were completely empty on the PA day to kind of help organize this new form of vaccine distribution on site at the school. And a lot of the lessons learned, I think, during the pandemic were now incorporated. For example, because Jane and Finch is, heavily populated by Black Canadians, they were recruiting Black clinicians to help administer the vaccines, to build trust with the community. They were thinking about the hours of operation. So the vaccine clinics would run from like 1 p.m. to 7 p.m. because 1 to 3, when classes are still in session, some of the kids could go and get vaccinated, but some of the parents might not want that to happen. They want to be with their kids because they don't really trust, the system to do that. And there's a period after school when that could happen. The booths that were being used for vaccination were wider because some of these parents are from multi-generational families and they had other kids that were tagging along. And so it was like really an in-depth, inside the hood of this, vaccine rollout kind of engine that the city was running that I thought was, really positive and reflected a lot of the lessons that the city had learned throughout the course of the pandemic. And we felt it was important to also tell this story because early on in the pandemic, in the vaccine rollout, we were very critical. Our reporting was very critical of the rollout efforts. And I think equally now that positive gains have been made and things are really been carefully thought out, we wanted to make sure we also told that story on a solutions kind of basis.
Thank you for that. I just wanted to switch over to some of the audience questions now. This first one is very important. It's one that I think about a lot. This is a question from Anise, who says, in the world, there were only journalists who were in the field to cover the pandemic, and they did very well, but the media owners don't care about their health issues. So what's your advice for journalists in the future to take care of their health issues as well? Because journalists also belong to society and they also have family to take care of, but their duty was so tough. Does anyone want to comment on either a personal experience or any sort of advice or learned lessons we may have gleaned from the past couple of years? You guys don't all have to rush.
Sorry, I'm just trying to understand the question. Like, do they mean how to like advocate for health journalism, or just how to like take care of yourself while you're doing this work?
I think the latter. I mean, like, especially during the pandemic, it became very clear that a lot of journalists were going through some very rough times, as anyone was, but you were not only expected to cover the pandemic, but live through it. And also what you were talking about with moral injuries when you're covering something like the toxic drug crisis, where thousands of people are just dying regularly. How do you deal with that? I mean, how do you continue work and be okay? How do you advocate for yourself? What needs to happen there?
Yeah, I think self-advocacy is really important, but I don't want to put like the individual kind of as responsible for that. But I don't know. I've been really lucky to be really supported at the Tyee, and so I know that my situation is unique. But I will say that I think I've done a lot of work in the last 2 years to really like take the world off my shoulders, and because I think as journalists we care about the issues. Like that's why we're writing about them and interested in them, and especially obviously like Indigenous and Black and racialized journalists have been like living like so much racism for so long and being expected to report on it and face it in their newsrooms. And so I think maybe for white journalists, this is like the first time we're like feeling so close to what we're reporting on, which is a very privileged position to be in. So I don't intend to speak as if this is new for everyone. But I will say that, yeah, just trying to take the world off your shoulders and realize that like it's not only up to you. Like a story that's going to really tax your mental health like isn't yeah, the moral injury is so real, and it's just important not to like feel like if you don't do this story or you don't whatever, like everything is going to go to crap. And I think that's a thinking process I've really tried to work hard to break. And yeah, also just like, yeah, knowing when you need to step away, and kind of allying up with either your colleagues or your editor and advocating for yourself, to take that time. Or, you know, I've also seen lots of people just step away from journalism entirely, and I think we really need to rethink like why journalism is seen as like a industry of like determination. You know, it's almost like, oh, if you don't stay, you like didn't want it enough, or you weren't like dedicated enough. But journalism is a really hard job, and it's a really hard industry in a lot of ways. So I just think like supporting your colleagues and yourself if leaving is the best thing for you, that's not a moral failing by any means.
Tired. Do you have any advice for journalists who may not feel supported by employers when you're covering something like when it's been that grueling and personally taxing?
Yeah, I can jump in here. Mostly because I think that I experienced it in the extremes of both in that scenario. Again, when I was with Indigenews, it was a 1-year contract specifically for health reporting. And at the time, it was an all Indigenous staff reporting team. And so we were all women, all Indigenous, and inherent to that, like just built in, we had built in camaraderie. You know, we didn't have to do the hour-long explanation of why a story was hard for us because it reminded us, in my case, my mother, her early years were in residential school. So if I'm writing about how to explain, that was for a different outlet, but there were stories that I wrote that were how to talk to young children about residential schools. And, you know, there's just built in compassion and, you know, the shortcut to those conversations. Oh yeah. And that reminds me of my dad, you know, someone might say, and like, yes, we know. And just being able to have those shortcuts to the conversation when you're working with a team of people who can identify with the lived reality and the background, like the intergenerational stuff, and how certain stories could trigger or matter. I don't want to say that like trigger so I would avoid. I'm the opposite. I would be more like, it speaks to me, so I'm definitely doing that one. And so I think that yeah, that's all. I think that part is on me, that I chose to do those stories fully aware of why it mattered so much to me, and the extra toll that it takes, and also the extra toll that it takes being transparent about your interest in a story and, you know, writing it in a balanced way. I think that that's all extra work. It doesn't automatically discount that you should write that story or not, but it does, there is a built-in extra layer of work. So in that case, there's 3 layers: hard story, personally meaningful, and then the call to responsibility to write that story. And so I think that by my temperament, I take to that challenge every time, and I never veer from it. But doing freelance journalism now, on the other hand, was very different. The hardest story I've written was the first month that I was freelance writing. And that story was published, again, it's still at Indigenews and then republished APTN National News. But it was a story about an RCMP shooting in Campbell River for Jared Lowndes. And it was very difficult in that it mattered so much, because it was one example of a very large problem, and how often it happens and how many times it happens. And I think that I felt the loss of a team right away. I was like, I'm alone writing this. I'm at my kitchen table. And that one again came from community. Chief Darren Blaney of Halmako phoned me or messaged me and said, can you phone my sister? She's the helper. She's the supporter in this moment. And so it was the same day that Jared Lowndes was shot by RCMP and killed. The same, by dinner time that night, I was on the phone making a plan to go over and spend the day with the family in Campbell River and do my interviews and cover it. And that was the time that I think lacking a team, lacking people to support and debrief with that, I did involve my family in that one. I took a step outside and I told my partner what had happened, just a simple sentence, and I just cried. And I think my partner intuitively, normally his response is, don't cry, don't cry, and the hug, and it's going to be okay, like focus on the positive. How can I take you away from that feeling? This time he just let me cry, and it needed to come. And it felt in that moment that it wasn't just about that story. It was about all those stories and the weight. And I think that giving into that energy and also responding to a community call just reinforced that I need to do this story and I want to do this story, and just trying to find energy from that. Like, that's an honor, and that's also it means you're doing something right, that you're being called to do this story. And so I think if you can find any nourishment from that and a little bit of empowerment, that means something, and trust in that feeling that therefore I'm going to treat this story in a really good way. It has energetically, that has to happen that way. And but lacking a team is a huge deal. It's very difficult to do some of these stories freelance. And something I really appreciated by the JHR, Journalists for Human Rights Collaboration, is right away they said, we have a counselor built into this process. It just so happens my stories are unlikely to need that debriefing. But then they said, oh, but if you have other things that, other stories for other outlets, whatever it may be, please tap into this built-in support. And I thought, that's the first that I've seen. And that's an amazing resource to have. And I would advocate for any outlets to consider strongly that, because although there's camaraderie and moral support within the team, also you may find that a team member is taking in a lot more of your private conversations too. For me, I have, a beautiful colleague. We're not with the Indigenous anymore as a team, but we're each other's team. We're always going to be. And but you're also presenting that into their life too. So having a built-in resource like JHR has would be incredible for any newsroom or outlet in whatever way they can.
Ty, did you want to add to that?
Yeah, I think, I agree with everything that's been said. I think what we don't talk enough about in journalism is just the business practices of the organization, right? Like often we're attracted to some publication, want to work there because, they're award winning and, it's a coveted role, but like, what are their business practices? Maybe they're amazing because it's all on the backs of the people working there, and that's not cool. So I think just check them out, make sure you talk to people internally. Do they have a commitment to raise representation and equity? Are they, paying people on time? Are there benefits? Are there supports for, trauma and things like that that come about to your work? So I think those are all really important things. I mean, I wear a couple of hats here. I'm also the editor in chief, and being a small publication, also I'm the publisher. And so for us, these things are really important. We have a race representation and equity commitment that we take very seriously. Last year, for example, we surveyed all of our contributors, and 73% of them self-identify as being from a racialized community. And so that is really important to us, is to make sure that because of the reporting that we do, have people from those communities who know the communities and know that they have the supports to do so when they work with us, et cetera. So I think these are important business practices that I think often don't, get enough airtime, and it's important for journalists to pay attention to them.
So we are almost at the top of the hour, but I think this question from an audience member is a great way to close things out. What advice do you have for new journalists reporting on healthcare? Moira?
Okay, as the new journalist.
You dove into this during the pandemic.
Yeah, as someone recently implied I was mid-career and I had a crisis because I was it's 2/3 of my non-student career has been in the pandemic, so I don't feel like any time has passed. Yeah, I think honestly, I was lucky I had a couple weeks before everything really changed. And I spent a lot of time with the Thai support, just talking to nonprofits and advocacy organizations and making connections. And I took a walk in the downtown east side and visited some clinics I wanted to connect with and just chatted with people. And that was really helpful and grounding my work and kind of starting to make some connections. But obviously that's different now that things are still a bit more remote than they were. But I would say, yeah, just start by getting into all the read the blogs, read the there's a BC Rural Health Network that I found that publishes a newsletter every month that I read religiously. It always has so much interesting information, perspective. I really start from kind of the advocacy and the patient side, and then I tend to try and build my academic contacts and my health authorities and all those sorts of things. But in terms of approach, just be curious, and I think be open to learning. Technical skills are really helpful too. I took a course through McGill on epidemiology for journalists with the support of the Jack Webster Foundation, and it was absolutely amazing. So if you can find there's lots of MOOCs through the Knight Center that are free to kind of help you get those technical study reading, data analysis skills. So helpful. But yeah, just be curious, and I think have an open mind about what is a health story and what this beat will be, because as everyone mentioned, health is so wide ranging, and I think it's only become more apparent that reality has only become more apparent during the pandemic, and we need so many more health journalists. So if there's a niche you can find that really ignites your passion and and keeps you interested in health journalism, I think that's a huge service to yourself and to readers.
I agree with that. I think there's a lot of technical aspects. I think there's also a lot of misinformation because it can be complex. So to cut through all the bullshit, like get familiar with, reading academic literature, or things like that, journals. Follow your favorite science journalists like Ed Yong or Andrea Wu, and what they do. How do they actually unpack complicated health stories? Yeah, those are some things I think are, for me, very practical.
Odette, do you want to add to that?
I think listening to your community is probably the biggest step. I think that those are the voices that you want to lift up, and those are the voices that you want to outreach as well. I think that my tendency is to, yes, I get a lot of press releases, I get a lot of newsletters. Those are the speaking points. If I interview that person, they're just going to pretty much read out what is already being refined for their press report. So although I do outreach to see if they have something else to add or more specifics, I think more interesting is to go to the voices that aren't being represented in those press releases. And I think that that's the onus is upon us to do that work and to find those voices. And I think that going in with that as an intention, people will receive that and they will respond to you. And I think that's probably the biggest and most important step.
Thank you. Well, I know the time. We are going to have to leave it there. I wanted to thank our panelists for sharing their insights today, and to everyone who joined in and those who asked some very thoughtful questions. Again, this will be posted on JHR's YouTube channel if you wanted to play it back or if you missed the beginning. So on behalf of everyone at JHR, we hope you found that informative. Thank you again for spending the hour with us, and hope you enjoy the rest of your day. Thank you.